happy to get started if you want to begin.
Yep, recording now.
Okay, great. Well, good afternoon, everyone. My name is Michelle Schwartz, and I'm a transition outreach specialist from Clearbrook. I've actually been working here, it'll be 12 years yesterday. So a long time doing this, but I've been in the field much longer. It's been my whole career just about working in the field of helping individuals with intellectual and developmental disabilities as well as mental health issues. I've worked with all ages really, except for that tinies, that early intervention folks. I've never worked with that age group, but everyone from school age up to seniors. So what I do as a transition outreach specialist really is helping schools and students and their families get connected to adult services and resources. So initially the position was funded through a grant through the Coleman Foundation, and it was a collaboration between 3 agencies, Clearbrook being one. The lead agency was actually UCP Sedgwick, located in Cicero, and Park Lawn, which is located in Oak Lawn, and we all do similar services, but this was back in 2009. They wanted to help educate families and schools about how services are delivered in Illinois for adults to help get students ready for transition. And we published a transition manual. It's now over 10 years old, but a lot of the information is still relevant, but the numbers and figures in there are obviously dated. We do have that manual on our website. If you would ever want to look at it, there's a timeline in there, but it's information that the schools have a lot on their websites as well as about transition related services. So one of the topics that I discuss with people is Social Security benefits, and I was asked to come and present to this group about that and how employment impacts Social Security benefits. So that's what I'm going to be talking about today. Just to back up just a minute, that Coleman grant, we expanded to 10 agencies, and then the grant expired, and not all the agencies maintained their transition outreach position, but Clearbrook has, UCP Sedgwick has, and also Park Lawn. So the original 3 have kept the position and continue just to provide additional transition outreach services to students in the community. So doing outreach presentations is a lot of what I do. I do attend IEP meetings. I've worked at Hersey High School and also the transition program over at Forest View Academy and Corey Young, and I attend many meetings together. So, and I'm very supportive of this project, the Jerry's Cafe, so I'm happy to help present information and hopefully can continue to stay involved with this group. So you can feel free to ask questions if you have them. This is an overview, it's a lot of information, and I don't know where you all are at with receiving Social Security benefits for your children or family members or loved one who have a disability, but hopefully this will be helpful. And I'm also available for questions via email or just phone calls if you have questions related to this topic. So am I in my way of my presentation?
No, you're perfect.
Okay. All right, so we're gonna do just a brief overview of what SSI is, Supplemental Security Income, and SSDI, Social Security Disability Income, which you'll also see called RSDI, which just stands for Retirement or Survivors Disability Insurance. And by the way, that's one of the things that makes this so confusing is there's so many acronyms and definitions. So we'll go over it, but you'll have this. Sheila, did she send you a copy of this PowerPoint?
She didn't, but I'm sure we can get it if you have it available for us.
Send it to you afterwards.
Yeah.
So we'll go over the eligibility, briefly how to apply, but I don't know if some of you don't need that information, but more I wanted to explain about how the benefits work and how employment impacts those benefits. So we'll talk about substantial gainful activity, student earned income exclusion, ABLE accounts, what impairment related work expenses are, the PASS plan, trial work periods, extended period of eligibility, and WIPA Work Incentives Planning Assistance Project, and that's another resource to help people manage their benefits when they're working. So just a very general overview of Social Security programs. There's two main programs through the Social Security Administration. The first one is SSI, or Supplemental Security Income, and the second one is Social Security Disability Insurance. Again, that's SSDI, you'll hear a lot. Or they're also calling it RSDI, which is a little bit more descriptive because it stands for Retirement Benefits, Social Security Disability Benefits, and also Survivor Benefits. So the way Social Security defines a disability is the ability to obtain and maintain what they consider substantial gainful activity. So if you're not able to perform substantial gainful activity because of a medically determined mental or physical condition, or a combination of both, that it's either expected to result in death or last a minimum of 12 months, you may be eligible for SSI. The determination or definition for a child with a disability under the age of 18 is a little bit different, and that's not really the focus of this program. It's for adults, so I'm not gonna go into that. But there may be children who are eligible to receive SSI as well. So the SSI program is a federal monthly cash assistance program for over 8 million people in the United States, based on having limited income and resources. So that's the other part of being eligible for SSI. It's not just having a disability, but also having limited resources. And I'll go over that resource limit, but $2,000 is all you're allowed to have in order to be eligible for that program. So the substantial gainful activity for 2022 is based on $1,350 a month. It's a little bit more if you have a disability that is blindness or statutorily blind, so it's $2,260 a month. And that amount goes up every year based on the labor, whatever statistic is that they use to determine that benefit amount. So individuals who are age 65 and older, or either blind or disabled, could be eligible for this benefit. And it's also called Title 16, is it Title 19? Title 16, that's what it says on there, Social Security authorization.
Wait, Michelle?
Yes.
The $1,350 is what they receive from?
$1,350 is what they consider substantial gainful activity. So if you're able to earn more than that, you don't meet the definition of having a disability, correct?
So that's for anyone who is applying, and if they have the supplemental income, it cannot be greater than $1,350 per month.
That's how
Earned
much,
income.
if you're able to earn, that's
Earned
not
income.
based on any other resources. But if you're working and you're able to earn at least $1,350 a month, you do not meet the requirement for Social Security's definition of having a disability.
And that's for the 2022, you said it changes.
Yeah, so every year it goes up based on whatever the labor statistics are. I think it's on in here.
Okay.
So I talked about the resource limit, which is $2,000, and that resource limit has not changed in, I don't know, 15 or 20 years. It's stayed at $2,000, and there's been legislation in the pipe about trying to raise that, because $2,000 is not very much. But anyway, for a couple, it's $3,000 for a married couple, in terms of the resource limit. So it kind of defines what income is considered money that you earn or receive from other sources, such as any benefits you might receive, or pensions, or the value of other items you get from someone else for food and shelter if someone's paying you to live in their home. And then resources include things that you own, your bank accounts, stocks, bonds, and other assets.
So that 2,000
Includes
is
everything.
in addition to the 1350? No, it includes the 1350.
1350 is the amount that they use to determine whether or not you're disabled.
Okay.
Based on your ability to earn.
Okay,
So it's separate from the 2,000, but if you have more than $2,000, you're not eligible regardless of how much money you can earn.
okay, so that could be gifts from family members, your savings account, whatever.
Right, so any money that's in a bank account in a person's name, those are considered resources. So if it's above $2,000, you're not eligible for SSI.
For the whole year, or what is the 2,000?
It's per month.
Per
So any
month.
month you're over that $2,000 limit, you are not gonna be eligible.
So it has to stay 2,000 or less?
Under 2,000.
Under 2,000, okay, thank you.
And that's why we're gonna talk about the ABLE accounts, and if you've heard of special needs trust, that's another way to secure income or resources so that you're not excluded from the benefit. So this goes into a little bit more what that substantial gainful activity is. The level of work activity and earnings, substantial if it involves doing physical or mental activities or a combination of both. Gainful is work or activity that is done for pay or profit, used to determine substantial gainful activity, and it's based on the National Average Wage Index. So, like I said, it goes up every year. It's $13.50 for an individual unless you're blind or meet the statutorily blind definition. And so it's a little bit more, $22.60 is the substantial gainful activity amount. So that's just for the SSI program. So the other program people can receive benefits through is the Social Security disability insurance, also retirement or survivor's benefits. And it's important to know that because that program is what you and I would be eligible for earned income that we pay through our FICA taxes, and our children, who, if they meet the definition of being disabled, may be eligible for those benefits at some point in their life if their parent either becomes disabled themselves or retires, or at the time of their death, as a survivor. So it's just a matter of when one of those three things happens. We're not gonna live forever, right? So depending on one of those things, your adult child might be eligible for those benefits off of your employment record or a parent's employment record as a beneficiary. So I kind of went over that, the retirement, survivor's disability, and so they kind of changed it to RSDI, but you'll still see SSDI because that's how they refer to it a lot. But the SSDI broadly encompasses the retirement benefits, survivor benefits, and the disability insurance. And they decided, well, let's make the acronym really fit what it means, so they changed it to RSDI, but I still see SSDI, and you'll hear SSDI too. So we kind of talked about this by a worker's contribution. So for us to receive, or an employee to receive that Social Security benefit when you retire, it's based on your earnings, and the older you are, the more work credits you need in order to get this benefit. So typically for an adult, it's 40 quarters or 10 years. You can get a maximum of 4 work credits per year when you're employed, and it's based on what they consider the work credit to be. For 2022, you get 1 work credit for $1,510 earned. So that could take an individual 6 months, a year, you know, or depending on how much they make. So it's not guaranteed 4 work credits, it's based on your earnings. You can't get more than 4 work credits a year. So for individuals who are under age 26, if their disability occurs earlier, they only need 6 work credits. Yeah, it says in here. So it's a little bit less if your disability occurs earlier on. The older you get, like I said, the more work credits you're going to need. So what else can I tell you about that benefit? What you'll see on the next slide is that many individuals are able for both SSI and SSDI. And that could be for a couple of different reasons. It could be the SSI they receive because they are eligible due to their disability and having limited income or assets. And maybe they have a parent who's retired. And because they're disabled, they're also receiving benefits off of a parent. Or a parent who's died or is deceased and then may receive survivor benefits. Or an individual may receive SSDI on their own work history. If they've been employed and they're earning work credits, they may be eligible as a person with a disability for the SSDI benefit that they're paying into through their own Social Security, taxes. And depending on what that amount is, they could be eligible to receive some from SSI and some from SSDI. So basically the folks that are gonna be able to receive SSI, are not able to obtain that substantial gainful activity, so their earnings are less, their Social Security benefit's gonna be less too, so sometimes that's why it's a combination. Once your earnings increase to the point that you're earning more than what the Social Security benefit, the SSI benefit is, you're not gonna receive the SSI benefit, you'd only receive the SSDI. So we'll talk about that. I think I put that on here. The other important thing about the SSDI is after an individual is receiving that for 24 months, they're also eligible for Medicare. So we have individuals who may receive private insurance, but they're also eligible for Medicare based on receiving the SSDI, not the SSI, but the SSDI for 24 months. And again, that can be through their own work earnings or through a parent's. So when a parent either retires or becomes disabled and is receiving Social Security, or upon their death, if their child is receiving survivor benefits for 24 months, then they're eligible for Medicare even if they're not 65. So that's kind of a big deal because it's a good insurance policy if they're not able to have insurance through their employer. So the right-hand side shows you just a little bit about the SSI. If you are eligible for SSI, you meet the eligibility for Medicaid. So you have to apply for it separately, but the income eligibility for Social Security also makes you eligible for Medicaid. So many people have Medicaid as an insurance when they receive SSI. But again, if they're receiving that SSDI, they may also be receiving Medicare, so they could be eligible for Medicaid, Medicare, Social Security, disability, as well as the SSI. And then I just put the SSI amounts on here. For an individual, the maximum SSI amount is $841 for 2022.
That's what they're receiving.
Yeah. That's the maximum that they
Maximum they're receiving, it varies.
It does vary. I'll go over that in just a minute.
Okay.
For a couple, it's $1,261 a month. So it does matter if you're married or not. And this slide just tells you what you need to tell Social Security about. So again, your marital status, if it changes, if you're married and get divorced or a spouse dies, or if you're single and get married, you need to report that. Certainly if your address changes, if you start work or stop work, if your rate of pay changes or your hours, all that information Social Security wants to know so that they can keep track in terms of determining what amount you're able to receive. And then I said the IRWE, impaired related work expenses, we'll go over that in just a minute too. Income, or if you receive a pension, if you've been convicted of a crime, if you leave the U.S. for more than 30 days, or the death of a beneficiary, all those things need to be reported. And I believe this is more about the eligibility here. Again, eligible, but the eligibility requirement for a child is based on the household income and other factors that, again, I'm not gonna go into, because we're talking about adults here, so 18 and over is when you're eligible as an adult. I wrote the second point already, and the maximum right now. So in order to apply for SSI, you can apply partially or do part of the application online, but it typically requires either in-person or a phone interview. They've been doing mostly phone interviews since COVID started. I don't know if they're doing some in-person interviews yet or not, but they will go back to in-person, I'm sure, at some point. And this slide says approval may take 30 to 90 days. That was really pre-COVID. They're taking at least 6 months now, sometimes longer. And it also said it's easier to be approved for adult Medicaid if you're already approved for SSI. Just because, like I said, the eligibility for SSI in terms of the income requirement meets Medicaid eligibility requirement.
Okay, so I have a question.
Another question.
So, the parent of someone who is an 18-year-old, so they're in high school, and you said that you go over and you help at the high school. So is that something you would tell the parent they need to do this process at age 18? No?
They can do it at age 18. It's after their 18th birthday is when they would be eligible. So, I mean, if I'm involved with the family, I would certainly let them know about that eligibility.
But typically, is it longer? They wait later after age 18, or what are you seeing? What are you recommending for families to do for SSI?
I would say if they're eligible, you can actually apply the month after you turn 18. So, yeah. I would say, why not? If
Yeah.
you're eligible.
Yeah,
You can
okay.
apply at age 18.
Okay.
Are families are they typically informed of this as part of like, the
Transition
IEP
services?
or transition process?
I mean, that's part of what I do when I'm there, is talk about those benefits. I think the transition specialists at the school do a little bit of that. The teachers are more knowledgeable and informed now. I do outreach presentation. I know the schools do lots of different transition events, so those events kind of include that information. And I know there's tons of information on the website about that, but, yeah, so it's a good question, but that's.
Once a student is 13, there's a part on, and that just changed like in 2015 or 16. But once a student turns 13, there's a section on the IEP each year that says transition. And you have to start telling the family when the child is like 13 and a half that they're gonna
14
have.
and a half.
Is it 14 and a half? Okay.
Yeah.
That they have to start doing this. So they're told, they're told a million times. And it's legally in a document that everybody in the room, the 12,000 people in the room have signed. And I can tell you a lot of people will say, oh, I never knew I had to do this. And you've been saying it for
It's a lot of
years.
information to take in, yeah.
It's a horrendous amount of information, and if English is not your first language,
Yeah.
it is unbelievable. And there's lots of fears of filling out government papers also.
Yeah.
So it's you really have to establish a relationship with the family and talk about it a lot more than the once or twice a year that you're there for an IEP meeting.
Yeah, cause that's not really the focus of the IEP either.
Right, it's a
an
very
additional-
small part. We used to have a separate one, once they were juniors in high school, we would have a separate. We would do it with the IEP, but we would have an additional meeting for any family that wanted it. Now, if the family said, I don't wanna come to any more meetings,
Right,
right,
it's true. You may not get the information.
it's very complicated.
This is really just a laundry list of items needed to apply for SSI. You have to have a social security card and a birth certificate, and then, you know, all this demographic information. But what Social Security is looking for is how does the individual's disability impact their ability to work? Because they're not gonna go based on an IQ score or you know, physical condition or medical condition. It's really how does that condition impact their ability to work. So the IEPs are actually great documents that support what they're doing in school, especially when they're in transition, because they're starting to explore work opportunities and have some observation of their employability skills. But the speech and the OT and the PT and social work and counseling minutes, all of those related services will talk about what are the barriers that we're working on to help them be more independent or, you know, be working in the community and accessing the community. So those documents are really helpful for Social Security, in addition to a psychological report that is gonna give you know, documentation of an intellectual disability, you know, if they have a neurologist or psychiatrist that's treating them, that can document what the disability is. But then the further piece is, how does that impact their ability to work? Like, is it distractibility? Is it memory issues? Is it, you know, manual dexterity, or you know, just attention to task, all these kinds of things. How does a disability impact their ability to work independently? So they want to know the specialist that the individual is seeing. So it could be the primary care physician, but like I said, it could also be a psychiatrist or neurologist if they're seeing those specialists as well. But for young adults, I think the school professionals are really great assets, because I mean, the teachers are great assets, but they don't have the credential that Social Security is looking for. They're looking for a clinician, so therapists, the speech, you know, PT and OT and the social work, those are the credentialed people they're looking for as to how that disability impacts their ability to work. So those documents are really helpful. And Social Security will say, well, you don't have to send us any of those documents, we'll request them. I always tell people, send them. The more you send them, the better, because it makes it harder for them to deny the case if they have to go looking for the records. So, you know, I always encourage people, those IEP documents, and particularly the 3-year evaluations that include those assessment reports. Those are the helpful ones for Social Security, because it gets to what it is that they need to know. So this is just the Social Security website and how to get to applying online. I've had problems with the online portal, but it's basically identifying information, and then you put a contact, and they will email you to set up a phone interview or in person when that's gonna happen. But having those documents to present or mail them in, so that the caseworker who's doing your case can see that information and then make a determination about whether it meets the definition for Social Security is helpful. But that's something that I help students with too. This slide talks about how the living arrangement determines what amount of Social Security you're gonna get. So it's depending on who you live with and who's providing you with a roof over your head. So if you're living in somebody else's household, are you receiving in-kind support and maintenance? Meaning, are they providing a roof over your head and food? And if that's the case, they're gonna reduce the maximum amount by 1/3. So in some cases, an individual may be able to pay their fair share of living expenses. If you say, okay, how much is the rent or mortgage in this house? What are the property taxes? What are the utilities? If you add it all up and then divide by the number of adults that live in the home, would your child be able to pay their fair share? If so, then they will give you the maximum amount. If not, then they're receiving in-kind support.
From $841.
Yes.
They're supposed to pay all that.
Mm-hmm.
So yeah, most people, I mean, you know, but there are some individuals that are somehow,
Contributing to the,
contributing, or, depends
Rent.
on where you live, certainly, everyone's housing situation is different. So yeah, it's most likely that they are, well, I won't even say most likely, it just depends on your living situation, that I get, yeah, so 841 is the maximum, so if you're receiving 1/3 less, then it's about $610 a month. You need to report your wages or your earnings by the 10th of the following month. So there's several ways you can do it. You typically have to go through Social Security to set up. There is a mobile app you can use, online. You can call them in or mail them in. Or they can set up an account online, but you do have to talk to Social Security in order to set that up. The student earned income exclusion allows you to earn a little bit more money than if you're not a student. So a full-time student is able to earn $2,040 a month and an annual $8,230 for the year. So that is helpful for students who are in school that are able to work. That income amount is a little bit higher. But it's not, now that school goes until the end of the school year when you turn 22, this earned income exclusion will end at age 22 regardless if you're still in school. So they haven't made that change, which I didn't know, but I found out this year. So this is how your earnings when you're receiving SSI are impacted by working. So the first $85 are excluded from your earnings. So, and then after that, it's Social Security will take 1/2 of what you're earning. So 50 cents of every dollar, or $1 for every $2 that you earn. So if you earned $850 a month, they would subtract that $85. It's actually a 65 plus a 20, but I'm just putting those two amounts together just for simplicity. So then your earnings are reduced to $765. You divide that amount by 2, and you would be at $382.50. It would subtract that amount from whatever you're receiving from Social Security. So I put that $610 on here. They would subtract the $382.50, and then you'd be left with $228 from the Social Security, plus your earnings. So you would still be earning more than if you didn't work and just were receiving SSI. A lot of people are worried, like, I'm gonna lose my benefits. You actually can continue to work, it's just a matter of how much you earn. And a lot of the students that I've seen are not, the reason they're eligible for SSI is they're not able to earn that $1350, at least not right away. Maybe they can work up to it, but in the beginning, while they're still building their work skills and their stamina and understanding how it goes, they're probably gonna be more limited, but it's still in their best interest to work while they're receiving benefits because they can maximize how much they can receive.
okay, so that reduced number of your 610 award is based on their living situation, or you just kind of?
Right, I just pulled it
Yeah,
out.
I know you
thinking,
pulled it out, but
yeah.
the max still could be the
Could be.
841,
Someone could be
but you're not
earning
saying most people
841.
are getting 841.
I don't have a good sense of most. I would say I see a fair number that are getting 841, but
Okay.
so it's probably
Okay,
50-50.
so that's that part, but then, the 50% taken from their earnings,
Mhm.
what is that? What?
They reduce your benefit amount.
Oh, they
So,
reduce the benefit
yeah.
amount, they're not taking it.
So SSI is for individuals whose disability impacts their ability to work. But if you're working, you're still gonna get some as long as you're not earning what we're gonna see in the next slide about that, trial work period. So if you go over that $1350, then you're no longer eligible for the SSI. But you can still receive some of the benefit while you're still earning.
So because I've had, and this is why we're having this presentation, I've had parents like just freak out because their kid got double shift over the holidays and was gonna
They put
earn
them
over
over.
$13.50. So when they exceed the $13.50 in the paid earned income, SSI goes away for good or for that month,
No,
or
it's for
how does
that
it work?
month.
That month, that month. So this is evaluated when you say report their earnings by the 10th of each month. Every month it is evaluated individually for each individual.
Yeah, and they're always 2 months in arrears,
Okay.
so, yeah, it's kind of, they're going back because they can't calculate the month you're earning it, so it's 2 months later, so that's why there's sometimes a hiccup. But why it's important, like if the hours change or your rate of pay, I mean, it is kind of a paperwork nightmare, I won't lie, I mean, it's a lot to keep track of, but, yeah, so.
So someone who, say, is on the spectrum but is very successful at their job and they accept a 40-hour-a-week job, they don't get any benefits because they're earning a salary that puts them over, they're no longer disabled,
Correct.
right?
Right, that could happen.
Okay, I know someone that his son, that is the situation.
Yeah.
So, but there's no benefits through SSDI or SSI.
Well, for either, really.
For either.
Because in order to be determined disabled, you have to meet their definition of what does a disability mean? It's not based on having autism, it's based on your ability to work.
Okay,
And that threshold is pretty low, $1,350 a month, I mean, you know, in terms of supporting yourself, right? But also there are many folks who will probably not earn that amount, but for those, so, yeah. So there isn't a supplement for those individuals who may just be a little bit above. That's, you know, that's where they draw the line. So yeah, that's the tricky part.
And if they go over that $13.50 and they don't get SSI or SSDI, they also lose Medicaid, correct?
They probably will not be eligible for Medicaid.
That's
Well,
what the big,
there may be a Medicaid program that they are eligible for, and I didn't put that in this presentation, it's not focused on Medicaid, but there is a Medicaid program called Health Benefits for Workers with Disabilities,
okay.
and they can earn more money. It's, like $25,000 a year, and they can still receive Medicaid.
Okay.
So they may not be eligible for SSI or SSDI, but they might be eligible for Medicaid.
okay.
This is just about impairment-related work expenses. I'm not gonna spend a lot of time on it, but you can look it up, but there are things that will reduce your earnings based on having an impairment-related work expense so that, there's less taken away. Like they will subtract, like they subtract that 85, they might subtract more money if you, need transportation to and from a job. Or if you see a therapist and that's because of your disability, but that helps you maintain your employment, or if you have certain medical equipment that you need, or, I don't know, prescriptions, but maybe they could be, if you can show evidence of how, you know, impairment-related work expense, you're paying, you know, out of your pocket, they will reduce that from your earnings so that, I mean, it could be substantial.
Does that include like paying for a job coach?
Typically, so it could, as long as there is no other resource for that job
Okay.
coach. So as long as DRS isn't paying, or Clearbrook isn't paying, or Little City, or whoever you're working with, if you're paying out of pocket for that job coach, that could be impairment-related work expense.
So they could earn $1,500, but $150 could go to that job coach because it's paid out of pocket.
Right, but so what that would do is here's an example, so again, you earn that $850, subtract the 85, so now you're down to $765, but then you spend $120 getting to and from work, so that makes your earnings even less, and then they reduce that by 1/2. So it's a big help for individuals who have those additional expenses due to their disability. So it's something important to, claim, and a lot of people don't know about it. So that just shows kind of the impact of claiming that earned impairment-related work expense. So Social Security also has something called a pass plan, which allows you to earn money and put it aside for, an employment-related goal. So it's again, another paperwork requirement. You have to set up these plans with a Social Security counselor, but if someone wants to have their own business, or they're saving for, a vehicle, or something that's related to their, employment goal, they can put earnings aside that's not going to impact their, like that $2,000 threshold. You could put money aside in a pass plan, and, that money will be there when you're ready to use it for an employment-related expense.
What's an example of an employment-related goal that you're saying would be acceptable?
Well, like a piece of equipment, like a photographer needs certain equipment and they're saving money towards that, or like I said, like a self-employed person. And I'm thinking about people with, other types of disabilities that, I don't know, not necessarily, I don't see it a lot with this population, to be honest, but it's not to say it couldn't happen. But it does have to be approved by Social Security. So it can't be a frivolous thing, it's a real goal, and based on, what their employment goal is, what they wanna do. But I think a piece of equipment is probably the biggest example I can think of that's gonna help them in their, home business or something. They could put some money aside.
So it's sort of like a savings account, but it's gotta be specified and
For what?
identified as to what the savings are going to purchase.
Right, and how it will help you in your employment goal. Then there is a trial work period for, SSDI there. Yeah, I guess that's right. So once you've earned enough work credits in your, employment, and you're earning more and more money, you, let's see, once you start, or even though that substantial gainful activity is $1,350, they start looking at your income once you earn $970 a month. That's gonna trigger what they call a trial work period. So again, and the incentive is, we want you to be able to work to your potential. We don't want you to be worried about, losing your benefits. So they built in this 9-month trial work period where they won't, take away any benefits during this trial work period, where you're just exploring, can I work more? Can I work more? Yes, I can work more, I can earn more, and nothing's gonna happen to my benefits. And that trial work period is 9 months, and it doesn't have to be consecutive. So maybe one month you work in $970 and you're all good, and then you don't work that much again for 3 months later. So I think it's over like a 5-year period too. So you can kind of practice and see, how it's going, how you're feeling, are you able to maintain it? So, and this is another reason why people get tripped up a little bit, because nothing happens to your benefits during those 9 months. And if people are earning more and they're not really watching or keeping track of it, suddenly, a year and a half later, their benefits are cut off, saying, you've expired your 9-month work, period, and you're no longer eligible. And, all this time, they weren't keeping track or whatever, so sometimes that happens. Yeah, it does say for 5 years. So, you have these trial work periods of $970, and you can actually earn anything over that. It can even be more than the $1,350, but they will count it. Once you've used up those 9 months, like I said, if you ever go over that $1,350, that's when you would lose your benefits. That's when they would say, okay, you've passed your 9-month trial work period, you're no longer eligible because you don't meet the definition anymore because you're able to earn more than that $1,350.
But I just wanna clarify, that's only for that month, the 2 months in arrears, but do they have to reapply again and start all over again and make a big, huge paper trail?
This is, yeah, it gets in your head, right? So, after the 9 months, they have an extended eligibility period. So, you get an additional 36 months where if you're not able to maintain it, you could go back and receive that social security, like they'll reinstate it, much simpler. So again, another incentive, like don't be worried about losing your benefits if you're really able to work, because if something happens that you can't, you can get them back. I know it's easier said than done, cause no one likes the paperwork and going into the office and whatever. It's not fun. But again, the program really is set up to incentivize people for working to their potential. They wanna see people be successful, and not worry about losing those benefits. So there is this extended, period of eligibility for an additional 36 months that you can get those benefits back if you're not able to maintain that employment. So that's kind of a safety guard.
And is the onus, 100% on the individual and their like care team? So like the expectation wouldn't be that Jerry's Cafe would say, you know, Natalie, you're approaching $1,400 this month.
No, I wouldn't
Yeah,
think that
so it's all-
the employer would have that
Yeah.
responsibility. The onus would be on the family or the
Yeah.
Individual, the employee. But it makes us wanna be aware of our
Be
staffing
sensitive to it, yes.
situation, that we're likely not going to hire someone for more than 20 hours
Right.
per week.
Exactly.
Yeah.
For those reasons.
Yeah.
And to help, and to watch out for those months that may have 3 pay periods. And, I mean, not that, again, it's not your responsibility, but you could be sensitive to it. And folks that really want to work and work more, I mean, we deal with that a lot, when people fill in for holidays and forget about the time and a half and how that impacts their check, so it is something to keep in mind.
Yeah, so 20 is kind of the cutoff, cause if you do $13.50, I don't know what people are gonna get paid, but if it's $15 an hour, you can work 22 hours a month, or
20.
a week.
2 hours a week. The parent I talked to who really sparked this, and she was going to come today but couldn't be here. But, she said, like those, what you just mentioned, having 5 weeks in a month is really a challenge.
Mhm.
They go over the 1350, so it's like,
Yeah.
he can't work that 5th week.
Yeah, I mean, that's.
But they have to watch it so
You
closely.
have to watch it,
Yeah.
yeah, which, like I said, is kind of that, bookkeeping nightmare.
Yes.
So I want to introduce you to WIPA, Work Incentives Planning Assistance, because this is a program actually paid for through Social Security, but this is what they do, help people manage their benefits, help them understand how employment is going to impact their benefits, and maybe help them figure out if they have an IRWI, an impairment-related work expense, that they could apply for to help reduce the impact to their Social Security benefits. There's a link here, and I've also got the referral, and there's a release of information that they need. You have to give consent to correspond with Social Security, but it's a good thing, so that they can be in touch with what your benefits are and how your work does. Now, I use them a lot when people get those overpayments or something, and WIPA's been great at helping them tease out, you know, what went on, what happened, why did they lose their benefits or something like that. But I would recommend for any parent to contact them when their child begins working to help understand that, and then there's a big change. They do presentations, webinars, 2 times a month. They're starting their fiscal 2023 calendar, but it'll be from January to June. When that calendar comes out, I can share it with you, but they're really helpful presentations, and I would encourage any of your family members that want to participate in that to do. I think there are 2 a month, one's like during the day and one's in the evening. They don't have their calendar ready yet. And then the ABLE accounts, I put this on here if you're not familiar with them. It is a way for individuals who are receiving Social Security benefits to put money aside in their name that's gonna be excluded from that $2,000 asset limit. It's really useful. ABLE is a nationwide, program. Not every state has one, but there's probably 26 or 28 that do. You can have an ABLE account from another state if you choose, but you can't have more than one ABLE account. And, there's a $16,000 annual limit on the account and a maximum lifetime limit of $100,000. So the ABLE account is money that is in the individual's name, so that's why a working individual, this is a good program for them, because a special needs trust doesn't cover any money that is in the individual's name. So the individual can't contribute to a special needs trust. It has to be money that it's in the name of the trust for that individual. So someone who wants to gift an individual money, they can put it in the name of the trust, and then that's gonna be secure. But for a person who's working, they can't put their own income in a special needs trust. They can go in an ABLE account, and then anybody can contribute to an ABLE account, but it does have a couple limitations, like I said, the $16,000 per year, and then a maximum of $100,000. And there is a fee for those ABLE accounts, because it's essentially a money market, account, and you can manage those funds. It's about $60 a year, so $15 a quarter. But if you're gonna be earning enough to cover that, fee, it's a good way to save money above and beyond that $2,000 for a bigger ticket item. If you are saving for, I don't know, it's supposed to be a, what do they call it, qualified disability expense, and I think, did I put it on here? No, I didn't. But there's a whole list of things, that are considered qualified disability expenses. It's anything that's gonna improve your quality of life, basically. So it could be used for, certainly any home purchase items, transportation, entertainment, travel, if there's any legal expenses, anything for the individual. It's not for other individuals, but for that individual. So those are all through, Fifth Third Bank in Illinois, but like I said, you can, look into other states, ABLE accounts, and maybe that's what I put on this slide. Yeah, the, link on the bottom there, ABLE NRC is the national website for ABLE accounts, so they let you compare up to 3 states' ABLE accounts online, so you can see which state has the better ABLE account for you. Just all how the money gets managed. I'm not an expert in that area, but some people can look at that and determine which might be in their interest. Or if you think you're gonna be eventually living in another state, maybe it makes sense for you to put your money there, but everything's done online now anyway, so. So I think that's the end of my presentation, but I'm happy to take any other questions if you have. I'm happy to come out at another time, to talk with you again if you have more questions, because you probably will. It's a lot. It's a lot to kind of absorb.
So as a transition outreach, you mostly work with high school aging out at age 22 and are you involved in job placement, or what kind of?
So I don't really do
tasks do
job
you-
placement, it's more connecting to resources.
Okay.
So helping people, if they're not on the PUNS list, get on the PUNS list, applying for SSI, applying for Medicaid, finding services in their area that can help support them, understanding what home-based services are, what are solo services, what are the services available in the area.
So Clearbrook, though, as a resource, do families who have someone in their 20s, are you accessible for free?
Mhm.
Okay, so they would make an appointment with you and,
So let me caveat that.
Yeah.
So the grant, when we started, it was more outreach and educating people. Once the grant expired, so people who are receiving those home-based funds, if they want my assistance, I will take it out of their home-based waiver because it is a Medicaid, service. For those individuals who are not receiving those funds, it's more of the outreach, so that's kinda how we did it. So if you're not receiving those home-based funds, I'm doing it as an outreach service, but for those who are receiving those, then we kind of try to get reimbursed for providing that service, so that's how it works.
And I have heard reference to this many times, and I am ignorant to what that means. What is the PUNS list?
That's another presentation.
Okay.
But PUNS
It's
stands
like an hour and a
for
half.
the prioritization of urgency of need of service, so. Quick thumbnail sketch, and I've been in this field, like I said, my whole life, so I know when this started, like in 2006, there was no way for the state to know how many people with an intellectual or developmental disability are in need of services. For the state to allocate enough resources to meet the need, there was no tracking system. So they came up with, okay, we'll create a list. So they created the PUNS list. And it wasn't until very recently, because of the Liggis lawsuit, they wanted to be placed in the community to receive community-based services, not necessarily living in a nursing home, that they started looking at this list. Oh wow, we have all these people on here, and through a lot of advocacy, a lot of legislation, they finally said, as part of the Liggis lawsuit, you have to determine a reasonable pace for people to be on this list, because they've been on the list for years and years and years and years to no end. So they finally determined legally that once you hit age 18, if you're on the list, you will be selected by your 23rd birthday within 60 months. That's considered a reasonable pace. So I encourage people to get on the list as soon as you know that your child has either an intellectual or developmental disability and you believe that they are going to need services. And that doesn't mean that they will necessarily, but if there's a chance you think they might, get them on the list now, because you never know when those services might be available for a child. And lo and behold, this year they selected 100 children off the list, which they haven't done in about 12 years. It's always been adults. So, I mean, initially when they put the list together and they took some children, some adults, and then the Liggis lawsuit hit and they had to serve more adults to meet the mandate of the lawsuit. But this year, I think because of the COVID resources, they had some additional funds so they could select 100 children off the list. If you're not on the list, you can't be selected for services unless there's a crisis, and then you could apply for services. And if you meet the definition of a crisis, meaning you're at risk of abuse, neglect, or homelessness, those are pretty much the criteria of a crisis, then you could be selected for services. So that's what PUNS is. It's just a statewide list of individuals with an intellectual or developmental disability from age 3 up. There's no maximum age. But the whole purpose behind this PUNS list really was to show the state of Illinois, the legislators, how many people we have, and in the future, how many do we have? So as the list grows, we need to allocate more resources so more people can get funding, because there was no tracking system before. So we were able to get a bigger increase this year than we have ever had, but that was just through a lot of advocacy and legislation. But at least we have a tracking system now, and we've reduced that waiting period to at least 60 months from the 18th birthday, so until something changes. But people, if they're on the list, they will get selected by the age of 23. So that's kind of good news.
Selected
To receive services.
all
So-
kinds of services or just
Well,
SSI?
it's not SSI,
Okay.
it's the waiver services through Medicaid. So Medicaid pays for what they call home and community-based services. So either receiving services within your home or maybe living in a community integrated living arrangement, or SILA. So Medicaid, the Medicaid waiver will pay for those SILA services or home-based services. And the home-based services is basically one-on-one support in your home for an individual to continue to increase and develop their independent living skills, access in the community, working on independent living skills, communication skills, anything that you want to have them work on. Or it also pays for community day service for adults to participate in activities in their community if it's a licensed DH, Department of Human Services program. And it can also pay for job coaching. They want you to first go through DRS for job coaching resources, but once you've exhausted those resources, you can use your home-based funding for community employment as well, for job coaching or job development, anything like that. What else is it good for?
Can you get PUNS and SSDI?
Yeah, so it's not, I mean, PUNS is the list, so what PUNS is, it's Medicaid waiver, so it's either
Medicaid
home-based
waiver,
services
okay.
or SILA, that's what the waiver is, there's
Home-based
two different. So, many of the folks that we receive, or we have services for are receiving SSI or SSDI and
Okay.
also Medicaid waiver services. And in order to live in a SILA home, you actually have to be receiving that Social Security too, because that's what pays for the
Pays for that,
room
yeah.
and board, in addition to the waiver. Any other questions? I know your heads are probably just spinning, but I will, well, Sheila has it, all the information. Did you wanna see the WIPA information, or you just get it later?
I was thinking, as that, you know, as kind of like a mini service to anybody that we employ, at the bottom of their agreement, when we hire them, that it has that WIPA information there. I thought that would be a nice thing to provide every single family and say, we truly encourage you to contact them so that you don't find yourself in an awkward situation. And I thought, are we getting a copy of this?
Yeah.
Yeah.
So this is the referral, it's pretty quick, but it just.
But even just that website and all of that, and then, you know,
Yeah.
and not that we wouldn't do more, but that's more than most places would do.
Right.
Is to provide that. But I thought that would be a nice thing to provide any employee
Yeah.
and their guardians or families.
Particularly if they're receiving Social Security. If they're not, then WIPA's not gonna be
Right,
that helpful. So,
And
but
just
for
to be,
individuals who
like-
are receiving SSI or
Supportive.
SSDI.
And like the simple is like the $13.50, like if they make $15 an hour, it's 90 hours per month. Like, you know, and so it would be 18 hours per week. So like if you were doing scheduling, you'd be like, you know, whoever's doing the scheduling, do they have to be like, it's 5 weeks, oh, it's, you know, 4 weeks and 2 days, or would you just say the maximum is 18 hours a week, so that they can be under the $13.50, assuming you make $15 an hour, whatever.
Yeah.
That would be the thing, you wanna educate the, you know, the parents or.
Yeah.
And again, that's for 2022, so probably
Right,
next year
right.
it'll change, but, you know, it
Right.
changes $20 a year or something like that, not
The
a whole
easier
lot.
the better, cause it is confusing.
Right. It's very
Well, we were thinking of going with 3-hour shifts, so that's 6 3-hour
Yeah, yeah.
shifts
Yeah.
Mm-hmm,
for the max workers.
Yeah,
right.
yeah, that sounds good.
Mhm.
Thank you, Michelle.
You're
This was
welcome.
very helpful.
Good.
A lot overwhelming.
Yeah.
And again, what parents have to do to manage all of this, you gotta be a CPA, an attorney,
Yeah.
and I don't know.
I hear ya, I know, it's a lot, and you know, I know as much as I do because I've just kind of gotten in there in the nitty gritty, and that's how you learn, cause otherwise no one else is telling you, right? So I help, like, can I apply with you? Let me see what it's like, what happens, cause I can't apply for myself, you know, there's no sample, so let's see what happens when we do this, and so I kind of learned. But feel free to refer anyone that you have that's transition age, and I'm happy to help. Cause I wanna get the word out, and I wanna be helpful, so.
Thank you, you're very helpful.
You're welcome.
Thank you. I know.
Well, I